Hi everyone, welcome to Eye Care with Dr. Babita. I'm Dr. Babita and I wish you all a very Merry Christmas. In this video, we will be talking about what else but Christmas tree cataract. Christmas tree cataract is a rare type of cataract which is characterized by multicolored needle-shaped deposits in the lens cortex, mostly the deep layers of lens cortex and also sometimes in the lens nucleus. These needle-shaped crystalline opacities give a dazzling multicolored appearance to the cataract, which makes it look very striking to the person examining it. This appearance of Christmas tree cataract depends on the angle of the beam of light illuminating it. In retroillumination, when the beam of slit lamp is perpendicular to the cataract, you will see only the borders of the cataract. But when the beam of light hits it directly, it shines like a crystal. And then at different angles of incident light, it shows a variety of colors like pink, green, gold. This multicolored shining appearance resembles a decorated Christmas tree, and that is why this cataract is known as Christmas tree cataract. Christmas tree cataract can be unilateral or bilateral. It can be present as an isolated cataract in the eye, or it can be present along with other types of lenticular opacities. There are various theories regarding the composition of these crystalline opacities. Some say that they are made up of cholesterol crystals. Some say that these are cystine crystals. Some also say that this appearance is due to the diffraction of light by cell membranes that are fused and stacked in a parallel fashion. Coming to the most important question, what is the significance of Christmas tree cataract? Number 1, it has a strong association with autosomal dominant myotonic dystrophy. In one study, it was seen that 16.7% of patients with Christmas tree cataract had myotonic dystrophy. If we go the reverse way, it has been seen that 56% of patients with myotonic dystrophy had Christmas tree cataract. And in almost 50% of patients with myotonic dystrophy, Christmas tree cataract is usually the first detectable sign of myotonic dystrophy. Thus, all patients with Christmas tree cataract should be referred for neuromuscular evaluation because most of these patients are otherwise asymptomatic. Myotonic dystrophy has other ophthalmic features as well. These include ptosis, pigmentary retinopathy, pupillary abnormalities, mainly light near dissociation, and reduced intraocular pressure. These features are collectively known as the 5 Ps. Christmas tree cataract has also been reported in patients with hypercalcemia, though in most cases it is idiopathic. Christmas tree cataract is not visually disabling to the patient in that it does not have any effect on patient's vision. Patients are usually kept on a regular follow-up until other lenticular opacities progress and start producing symptoms. Then we can consider the patient for cataract surgery. So that is all for this video. Please like and share this video with your friends and colleagues if you found it useful, and please subscribe to this channel to support free education. Thank you very much and have a great holiday season.